I was working in the wards with Dr. Ma, who's a hospitalist, and she practices evidence-based medicine. And we were treating we were seeing a lot of C. diff infections coming in, and we also had a lot of patients on antibiotics. And we thought, is there any way we could be preventing C. diff infection? Because we know hospitalized adults receiving antibiotics are at high risk for C. diff infection. And when we looked at the literature, we found a Cochrane review in 2012 that suggested probiotic efficacy for prevention of C. diff infection. They conducted the study, though, in inpatients, outpatients, adults, and children, so it wasn't exactly our patient population. So our summary estimate, which is the pooled analysis of all the trials, we had 19 trials total in the end, after searching through over 1,600 results. And in those 19 trials, we found that the relative risk of probiotics, the probiotic cohort for C. diff infection compared to the control cohort for C. diff infection was 0.41, with a conservative upper interval of 0.57, which suggests that there's significant reduction of C. diff by using the probiotic for prevention of C. diff. So we looked at studies that the patient got the antibiotic and afterwards were given a probiotic. But what I think is really interesting about that question is the studies did different, they included different length of time between when the first antibiotic dose was given and when the first probiotic was given. So for example, Placid, they included the patients that had received the antibiotic up to maybe 7 days before they got their probiotic. And some of the other trials, like the most recent one by Earhart, done in 2016, that was published this January, they only included those that received the probiotic within 2 days of the first antibiotic dose. And we actually did a subgroup analysis, and the only one that came back significant was the timing of when the probiotic was given in relationship to the antibiotic. So if your probiotic was given within 2 days of your antibiotic dose, then your relative risk decreased even more. I think it was to 0.32, and your conservative confidence interval, which is that upper level, was 0.47, which was significantly different than what we saw if the probiotic was given greater than 2 days after the first antibiotic dose, where the relative risk, I can't remember the exact number, but the confidence interval crossed the null. And so that was a new finding that hadn't even, like the Cochrane review in 2012 didn't really look into that. So we thought that was very interesting. But just to complete that answer, the different trials gave different lengths of probiotic dose. So some gave it up till when the antibiotic finished, or some continued for 2 weeks after. Basically, of these 19 trials, there were 12 different probiotics evaluated. And so the most commonly evaluated probiotic was Saccharomyces, and that was done in 5 of the trials. And then in 3 of the trials, they evaluated Lactobacillus GG, is also how sometimes people refer to it. And then in 2 of the trials, they evaluated Lactobacillus acidophilus and Lactobacillus casei. And then the rest, it's just one single trial evaluating that probiotic. Well, one thing we haven't mentioned is all these trials had their own exclusion criteria. And so some common themes were excluding immunocompromised patients and patients that had GI disease, actually, like inflammatory bowel disease patients and patients with pancreatitis. So, because one of the things that we also haven't talked about is probiotic sepsis. And so none of these trials had an event of probiotic sepsis. And of the adverse events reported, there was not more seen in the probiotic group compared to the control. But it's important to know it was a little bit of a limited population. So we think that one of the big take-home points is, though it's a limited population, it's still a big population because the majority of adults coming to the hospital are immunocompetent, and over 53% or 50% of adults, I think it's like 54%. And we think that, if your patient kind of meets these criteria, then it may be worth considering giving them a probiotic if they're getting an antibiotic, and that we need to further investigate, what exact dose and which probiotic to recommend but we do think it's something that clinicians should consider.